Hello students, now let's discuss regarding antibiotics. As per antibiotics, we are going to be classifying it in a different manner. We'll be classifying whole of the antibiotics into non-specific and specific antimicrobial agents. Non-specific and specific antimicrobial agents. What exactly is this non-specific and specific? See, if we have an individual antibiotic and if it is targeting a group of bacteria, those kind of antibiotics will be called as non-specific antimicrobials. Whereas specific antimicrobials means those, for example, we have a single bacteria and we have multiple drugs which are targeting that particular bacteria, that will be called as specific antimicrobials. For example, we have anti-tubercular drugs, anti-leprotic drugs. Mycobacterium tuberculosis, a single bacteria, is targeted with multiple drugs. Leprosy, the same thing, is targeted with multiple drugs. Whereas penicillins, for example, we have an individual drug which is targeting multiple different bacteria, a group of bacteria, like group of gram-positive, group of gram-negative, or broad spectrum, similar to those kind of agents. Within those non-specific antimicrobials, we're going to be classifying them into 5 important subjects. The first one is drugs which is inhibiting cell wall of the bacteria, drugs which are inhibiting the cell wall of a bacteria, cell membrane of a bacteria, protein synthesis, and nucleic acid synthesis. 4 major subtypes, but within those nucleic acid synthesis we have 2 major subtypes called as directly acting and indirectly acting agents. Directly acting and indirectly acting agents. So totally 5 types, and which can usually be the last one can be subclassified into 2 major ones: direct nucleic acid synthesis and indirect nucleic acid synthesis inhibitors. We'll start with the first one. Let's look into what exactly are the cell wall synthesis inhibitors and how to remember the drug names, whether they are bactericidal or bactericidal. Similar thing for cell membrane, protein synthesis, directly acting nucleic acid and indirectly acting nucleic acid synthesis inhibitors. We'll start with the first one, cell wall synthesis inhibitors. What are all the drugs which are included there? We have some basic drugs like beta-lactam antibiotics, which includes penicillins, cephalosporins, carbapenem, and monobactam. Penicillin, cephalosporin, carbapenem, and monobactam. The other drugs, this can be remembered with the mnemonic Facebook wall on personal computer. This is the mnemonic to remember that. FB wall on PC is the mnemonic to remember the drugs which might inhibit the bacterial cell wall. F is for fosfomycin, B is for bacitracin, wall is for remembering that this mnemonic is for cell wall synthesis. P is for peptide antibiotics. We have 2 different peptide antibiotics, polypeptide and glycopeptide antibiotic agents. Here we are talking about glycopeptide antibiotic agents, which includes vancomycin and teicoplanin. Vancomycin and teicoplanin, these drugs are glycopeptide antibiotic agents. And C stands for cycloserin. We're going to be looking into certain other concepts also. All these drugs are bactericidal in nature. An important statement. All these cell wall synthesis inhibitors are bactericidal, which means everything is going to be killing off this particular bacteria. And of course, you know the difference between bacteristatic and bactericidal. Bactericidal means killing the bacteria. Bacteristatic means stopping the replication, multiplication. Simply family planning for the bacteria. That's what bacteristatic agents are. And all these drugs are bactericidal except cycloserin. Please note, this is an important statement, except cycloserin, which has got mixed activity. Against some bacteria it behaves as bacteristatic, against some bacteria it behaves as bactericidal, primarily based on the concentrations. If it is there on lower concentration, static. Higher concentration behaves as bactericidal agents. The next important point, we have an important bacteria called as mycoplasma. Mycoplasma is resistant to all these drugs. Mycoplasma is resistant to all these cell wall synthesis inhibitors because mycoplasma lacks cell wall. So which drug is going to be effective against mycoplasma? Macrolide antibiotics will be effective against mycoplasma. We'll be discussing that in few minutes, don't worry. So these are all the different drugs which are cell wall synthesis inhibitors, guys. Good. With this, we'll move on to the next one, cell membrane synthesis inhibitors. Similar to that, we also have a mnemonic over here called as PODA. PODA is the mnemonic. PO stands for polypeptide antibiotics. DA stands for daptomycin. Polypeptide antibiotics includes polymyxin, colistin, and tyrosine. Polymyxin, colistin and tyrosine, these three are polypeptide antibiotic agents, whereas polyenes are amphotericin B. Polyenes is going to be amphotericin B and haemycin. Simply, polyenes are antifungal drugs, guys. Polyenes are antifungal drugs, whereas polypeptide antibiotics and daptomycins are proper antimicrobial agents. It's going to be killing of the bacteria, antibacterial drugs. So from this we can easily understand that polyenes are like amphotericin B and haemycin are fungal cell membrane synthesis inhibitors, whereas daptomycin and polypeptide antibiotics are bacterial cell membrane synthesis inhibitors. Similar to the cell wall synthesis, these drugs are also bactericidal in nature. No confusions, no ifs, no buts. All these drugs are bactericidal in nature. We'll move to the next one, guys. Let's talk about protein synthesis inhibitors. We have a very bigger classification for protein synthesis. Let's look into those basic drugs at first. Basic drugs includes aminoglycosides. We have macrolides, tetracyclines and chloramphenicol. Aminoglycosides are those drugs which are ending with mycin and mycin drugs. Aminoglycosides are those drugs which are ending with mycin and mycin, whereas macrolide agents are those drugs which ends with rhomycin agents. Macrolides are rhomycin agents like azithromycin, clarithromycin, erythromycin. Those kind of rhomycin agents are macrolide antibiotics. Tetracyclines, easily understood, drugs name will be ending with cyclin. Tetracyclines like doxycycline, minocycline, all the cyclin agents. Chloramphenicol itself is an individual drug. It is not a group of drug. Okay, these are the basic drugs, guys. Basic drugs which might inhibit the bacterial protein synthesis. Now let's look into the other drugs which might inhibit bacterial protein synthesis. This can be remembered again with the mnemonic protein loss FM is the mnemonic. Protein loss FM is the mnemonic. So here, protein example, pleuromutilins. Loss, L is for lincosamides, O is for oxazolidinones, S and S is for streptogramins, S is for sordarins, and F and M, fusidic acid and mupirocin. Out of this pleuromutilin, this is a group of drug name, guys. Drugs name includes retapamulin and lefamulin. Retapamulin and lefamulin, these are the drug names. The group of drug is pleuromutilins. Whereas lincosamides, on the other hand, again the drug name will be ending with mycin, guys. How we have aminoglycosides which are ending with the mycin and mycin. Lincosamides also will be ending with mycin, but here the drug name will be having lin in its name, which means we have lincomycin, and clindamycin. Lincomycin and clindamycin, these are your lincosamide agents. Oxazolidinones, drugs name which are ending with zolid. Drugs name which are ending with zolid, example, we have linezolid, tedizolid, iparazolid. All the zolid agents are oxazolidinone agents. Streptogramins is a combination of two drugs, guys. Dalfopristin. Streptogramins is a combination of dalfopristin and quinupristin. Dalfopristin and quinupristin given as combination. Of course, they both can be given as monotherapy, but always preferred to be given in combination. We'll look into that, why it is given only in combination later on. Sordarin is an antifungal drug. So similarly, how we have seen one more antifungal drug which might inhibit the bacterial cell membrane synthesis, which is your polyenes like amphotericin B and haemycin. Similarly, we have a protein synthesis inhibitors for a fungus, which is sordarin. Fusidic acid and mupirocin are individual drugs. These are not a group of drugs, guys. So these are all the different drugs which might inhibit the bacterial protein synthesis. Remember, this is a bigger classification, but all of these drug names are very much important for the exams too. Now with this, we'll proceed on further. Let's look into what is the mechanism of action of individual drugs, in which ribosomes these drugs will be producing its mechanism. Of course, we have 30S and 50S ribosomal subunits. Here, a very old mnemonic, guys. Bi at 30, cell at 50. Bi at 30, just remember only that, because cell at 50 is not going to be useful right now. Just bi, that will be enough. A stands for aminoglycosides, whereas T stands for tetracyclines. A stands for aminoglycosides, T stands for tetracyclines. These drugs is going to be inhibiting 30S ribosomal subunits. All the other drugs, which includes protein synthesis inhibitors, will be binding and inhibiting 50S ribosomal subunit. As simple as that. Don't follow with that cell mnemonic, guys. Previously, when that mnemonic was derived, only few 50S ribosomal subunit inhibitors were there in the market. Now we have multiple other drugs. To just remember, bi at 30 will bind at 30S. All the other drugs will bind with 50S ribosomal subunits. All are static. What about bacteriostatic or bactericidal? We have cell wall, cell membrane, all are cidal. Here all are static, except an actual exception is going to be aminoglycosides. Aminoglycosides are purely acidal bactericidal agent. Next we have sardarin, which is a fungicidal agent. Next also we have chloramphenicol. Chloramphenicol has got mixed activity values, like how we have cycloserine, which has got mixed activity. Against some bacteria it behaves as bacteriostatic, against some bacteria it behaves as bactericidal. Similarly, we have chloramphenicol, which also behaves as mixed activity. And of course we have D plus Q drug, D and Q, dalfopristin and quinopristin combination. When given as monotherapy, it behaves as bacteriostatic. When given together, it behaves as bactericidal agent, which is a classical example of synergism, guys. I hope we have explained about that already in general pharmac itself. Regarding when both of these drugs are given together, the action is going to be exaggerated more. Well, that is what called as synergism. These are the actual exceptions regarding bacteriostatic or bactericidal within protein synthesis inhibitors. As I've told, protein synthesis inhibitors, we have a bigger classifications. All these drug names are very much important, guys. We'll proceed on further. Let's look into what are the nucleic acid synthesis inhibitors. Within nucleic acid, we have directly acting and indirectly acting agents. Directly acting basic drugs like quinolones and fluoroquinolones. What are all those fluoroquinolones? Floxacin agents. Ciprofloxacin, Norflox, Oflox. These are the floxacin agents which will bind with the nucleic acids directly and tend to inhibit that. Whereas the other drugs, we have a mnemonic over here. Nino, Clo, and Metro is the mnemonic. Nino, Clo, and Metro is the mnemonic. With this, Ni stands for nitrofurantoin, No stands for novobiosin, Clo stands for clofazimine, and stands for actinomycin D. Met is for metronidazole, Rho is for rifampicin. All these drugs are bacterial nucleic acid synthesis inhibitors. The one which is there in the display are all bacterial nucleic acid synthesis inhibitors. And again, bacteriostatic or bactericidal, Nino and Clo are static. Nino and Clo are static, others are cidal agents. Nino and Clo are static, others are cidal. So, as per your drug names is concerned, nitrofurantoin, novobiosin, and clofazimine are bacteriostatic in nature, whereas all the other drugs are bactericidal in nature. Well, that's it about nucleic acid synthesis inhibitors, directly acting nucleic acid synthesis inhibitors. Let's look into those indirectly acting agents. Indirectly acting agents means these drugs will inhibit folic acid synthesis, guys. That's why we have named it as indirectly acting nucleic acid synthesis inhibitors. These are folic acid synthesis inhibitors. We don't have a mnemonic and all, just few set of drugs like dapsone, which is the anti-leprotic agents, pyrimethamine and proguanil, sulfonamides and trimethoprim. All these drugs are nucleic acid synthesis, indirectly acting nucleic acid synthesis inhibitors. Again, bacteriostatic or bactericidal, all these drugs are bacteriostatic in nature. Again, we have one more exception. That exception is the combination of sulfonamide with the trimethoprim, guys, and the drug name is cotrimoxazole is that drug's name. Cotrimoxazole is that drug's name. This drug is going to be a bactericidal in nature. So, defaultly speaking, cell wall and cell membrane synthesis inhibitors are bactericidal in nature, guys. We have few exceptions. Just remember those exceptions. That will be enough. Defaultly, protein synthesis inhibitors and folic acid synthesis inhibitors are bacteriostatic in nature. We have some exceptions. Whereas nucleic acid synthesis inhibitors, we have some equal difference. Nino, Clo are static. The other molecules are bactericidal in nature. These are the different classifications of the non-specific antimicrobial agents. Now let's look into the next important feature. What are all the antibiotics which are safer to be given in terms of renal failure? Antibiotics safer in renal failure. Similarly, what are all the antibiotics which are safer to be given in pregnancy? We are going to be looking into these two important factors, my dears. See, as I have told already multiple times, drug of choice, yes, that is important, but the questions are now not primarily targeting the drug of choice. The questions are primarily targeting the drug of choice for patients with certain comorbidities. So we have to know which antibiotic is the drug of choice if the patient is suffering from renal failure because of a particular infection. So drugs which are safer in renal failure, I'm going to be explaining that with the mnemonic. It appears like a rhymes, guys. Mac and a link. Remember this like a rhyme. Mac and a link. Ampi and a napsy. Ampi and a napsy. Rifampy and doxy. Moxy and two zones. Moxy and two zones. So now let's this is the rhymes which you have to remember regarding the antibiotics safer to be given in renal failure. Let's look into those in a deeper perspective. What exactly is MAC? Macrolides, like your azithromycin, clarithromycin. Link stands for lincosamides, like your lincomycin, clindamycin. Ampi is for ampicillin. Napsy, we know, nafcillin. Rifampicin. Doxy is for doxycycline. Moxy is for moxifloxacin. Remember that. Here it is going to be moxifloxacin. And two zones includes two cephalosporins which are ending with zones, guys. Cephalosporins which are ending with zones are, of course, you would have guessed, a commonly used drug, in your internship you would have used it, or in your future, if you're doing your internship, you would be using it multiple times. Zone is that drug, ceftriaxone, and one more drug called as cefoperazone. Ceftriaxone and cefoperazone. All these drugs are safer to be given in terms of renal failure. Let's look into the drugs which are safer to give in pregnancy, guys. In pregnancy, again, the basic drugs like penicillins and cephalosporins are safer to be given in pregnancy. Regarding the other antibiotics, regarding protein synthesis inhibitors, we have azithromycin and clindamycin. These two drugs are safer to be given. So as per pregnancy is concerned, within cell wall, we only have penicillins and cephalosporins. For cell membrane, there is no drugs which are proven to be that much effective in terms of pregnancy, even though we can give, not that much safer to be given in pregnancy. Regarding protein synthesis, we have azithromycin and clindamycin. What about anti-malarial drug? Which drug is safer to be given in pregnancy? Quinine is the safer anti-malarial drug to be given in pregnancy. Quinine, actually we give it in combination with clindamycin, which is already been understood by now. Then regarding other parasitic infections, we have spiramycin, we have paramomycin. Spiramycin and paramomycin, these drugs are safer to be given in pregnancy. And the last one, the antifungal drug which can be safer to be given is LAMB drug, guys. Liposomal amphotericin B. Liposomal amphotericin B is the antifungal drug which can be safely given in terms of pregnancy. So we have two major lists, guys. Drugs which are safer in renal failure, drugs which are safer in pregnancy. These 2 points are very much important for the exams. So till now we have completed the basic concepts of what are all the different non-specific antimicrobials and how do we classify it, and we explained about antibiotics safer in renal failure and safer in terms of pregnancy.